And why do you have a redo or a revision? Don't always assume that a redo or a revision is a nose that has been spoiled or botched up by a surgeon. That's not the case. I've been performing these surgeries for around plus 2 decades, and what I've seen in my experience is that the patient's desires could also be a need for a redo. Very often, the patient is not expressing the exact desire to the surgeon, thereby leading in the nose shape or nose form that they don't like perfectly. Rarely redos happen after an infection from an earlier rhinoplasty. Rarely redos can also happen because it's a botched up nose job. Yes, that also is one of the reasons for a redo. All right, so you can have redos with multiple reasons. Now, does redo require better skills? Absolutely. Redos are the most challenging aspects of rhinoplasty or nose jobs. So let's say a patient has a redo. Why is it just plainly difficult? The first and foremost reason is, as a surgeon, when I'm looking at a redo, I'm not only trying to see the issues patients having, but also trying to find out what was done in the last couple of surgeries by the earlier surgeon, because only then I can correct it or give a better solution. So this is more challenging. Sometimes there's a lot of scarring. Well, sometimes it gets easier because the surgeon has placed a big silicone implant and it's through bulbous tip. We all know, we can see the implant, we can feel the implant, I can measure it out in the scan, so it's pretty easy. So I know, okay, this needs to go, and we can do blah blah with the tip, we can get the rib cartilage done for the septal extension graft or for the spread of flaps, whatever. Now, every time it's not like that. Sometimes the earlier surgeon or the earlier person has already used different types of grafts and they don't have a discharge summary. So it's because the patients don't have a detailed discharge summary